Hello guys, so today we shall be discussing another important topic, that is Candida albicans. I hope all of you know what is Candida albicans, right? So let us discuss some more details about Candida albicans, right? Candida albicans. Now, when you look at this Candida albicans, the yeast, first of all you have to know the structure of this yeast, right? So before knowing the structure of this yeast, simple thing to know is that this Candida albicans lives in two forms. I mean, it has got two forms. One is called as, it has got the yeast, at the same time it has also got the pseudohyphae, right? So what I am trying to tell you is, it has got two things, right? What is that is, one is called as the yeast, right? The other one is called as the pseudohyphae. So one is your yeast and another one is called as pseudohyphae. Now what is this yeast and what is that pseudohyphae is very important to know. For example, let me draw a simple picture of that. So whatever you are seeing right now, whatever picture I am making right now, right? So this picture is the picture of the yeast. Okay, so this will be the picture of the yeast. And tell me, how is this yeast, guys? This yeast, is it branching or non-branching? Obviously the yeast is a branching yeast. Okay, so this is a branching yeast. Now on the top of this yeast, you see some round color structures. At the end part of the yeast, you're gonna see some round color structures. These round color structures are called as budding yeast cells. And whereas these green color things which I have drawn, these are called as pseudohyphae, right? So let me mention the names. So this is called as budding yeast cell, okay? And these green color things over here, they are called as pseudohyphae. So you need not to know the picture of that, but what you need to know is that Candida albicans has got two things. The structure is comprised of two things. One is called as a branched pseudohyphae, and on the top of the pseudohyphae you have got your budding yeast cells. So when, first of all, this Candida albicans, right? So as this is growing, so everything grows from a single cell, right? So as this is growing, the initial stage of the cell, whatever you see, right? For example, in the humans, the initial stage of the cell, the embryo, the same thing. As this Candida albicans is growing, if you look at this Candida albicans, so this is how you look here. This is a small germ tube. This tube here is called a small germ tube, and on the top of the germ tube you have got a budding yeast cell, right? So this part, this entire unit here, is called as a germ tube cell. And what is the temperature at which this germ tube cell is formed? It is formed at 37 degrees centigrade. Okay, so if you look at, let me show you the picture, the exact picture of how this pseudohyphae and the yeast cells look. So as you can see here, guys, whatever I have drawn previously, right, whatever things I have drawn previously, I am trying to show up here. Now if you look at these things over here, right, if you look at these things, so this small round color bubbles which you can see here, this things, this is called as your budding yeast. Cells. So from the terminal portion of the budding yeast cells, for example, this is a budding yeast cell. Slowly from the terminal portion of the budding yeast cell, slowly the yeast, this is a budding yeast cell. So from the terminal portion of the budding yeast cell, slowly a germ tube comes out like this. As you can see in the second picture over there, right? So this is a budding yeast cell. From the budding yeast cell, you see a small protrusion outside, right? So this protrusion here is called as a germ tube cell, and this germ tube is formed at 37 degrees centigrade. And once they divide, these germ tubes, obviously they progress, they grow, and after that they divide into pseudohyphae, which you can see in the next picture, that is A. So this is a pseudohyphae along with the budding yeast cells here, right? So this is the basic picture which you can see in case of Candida albicans, right? Now there is nothing much to discuss about this, but the important thing is, what are the different types of diseases it is gonna cause. So if you can look regarding the infections that are caused by this, if you can look at the infections that are basically caused by this, so I am dividing these infections into two types. What are these two groups of infections? These two groups of infections are, two groups of people are most commonly affected with this Candida albicans. Now, who are these two groups of people? The first group of people are immunocompetent. Immunocompetent means those whose immune system is very well, is working well, like you and me, right? So even in you and me, both of them are called as immunocompetent individuals, right? Because our immune system is working well. On the other hand, for example, if a person is suffering from some kind of malignancy, any cancer, any kind of leukemia, any kind of, let us say, HIV. So all these individuals are not immunocompetent, they are immunocompromised. Their immune system is compromised. So they are immunocompromised and we are immunocompetent. So this Candida albicans affects both groups of people. One is immunocompetent and other one is immunocompromised. So in immunocompetent people, what type of diseases it is gonna cause? Always and always remember, in immunocompetent people, Candida albicans always causes infections related to the skin and mucous membranes. This is a simple shortcut. Let me mention it to you. So Candida albicans in immunocompetent people mainly causes diseases that are related to the skin and mucous membranes. Okay, keep this thing, print this thing in your mind. If you see any disease of Candida albicans regarding the skin, let us tell skin in the sense the tongue, right? The skin on your face, the skin on your hands, the mucous membranes and all of that. So if there is any damage there, right, if there is any involvement of this infection, then it is immunocompetent individual. Okay, let me give you an example, guys. I'll show you the pictures later. But let me just write it down. What are the things which you can see here? The first important thing is, for example, let us say I am a patient of asthma, right? I am a patient of asthma. I have bronchial asthma. So obviously, when you have bronchial asthma, you will be given a corticosteroid, right? A corticosteroid, because corticosteroids reduce inflammation. All of you know that. So I give you corticosteroids. Corticosteroids are inhaled. I give you inhaled corticosteroids so that you can take and puff inside. But one important thing, all of you have to know that you will learn this from your physiology lectures, but let me just roughly make it down, make a note that in asthma I am using inhaled. In asthma I use inhaled corticosteroids. CST stands for corticosteroids. So all of you need to know this basic thing, that what are the basic functions of corticosteroids, guys? The basic functions of corticosteroids are, one is corticosteroids increase your blood pressure, right? Next, corticosteroids, what they do is they cause immunosuppression. Increase your blood pressure, cause immunosuppression, right? They induce gluconeogenesis. Okay. Next, not only that, they decrease the fibroblast activity. Okay. Next important thing is that they are responsible for insulin resistance. And finally, they decrease the bone formation. So if you wanted to list out what are the important functions of corticosteroids, so these are a set of functions of corticosteroids. Now how do I remember this? You will learn it in your physiology lectures, but as we have discussed this, let me mention it to you. Remember this by mnemonic, big fib. Anyways, this is not a part of microbiology, this is a part of physiology, but let me explain it to you. Big fib. What does big fib stand for? B is BP, I stands for immunosuppression, G stands for gluconeogenesis. The first three are responsible to increase. The next three are responsible to decrease, like decrease fibroblast activity, insulin resistance, and decrease bone formation. So out of all this, the important thing which we need to take into consideration is that immunosuppression is the most important function of corticosteroids. That is the reason why, guys, for example, if a person is having a liver transplantation, for example, let us say my liver is damaged and I have taken someone's liver into my body. So that will be a foreign liver entering into my body. My immune system will think that this guy was having liver till 20 or 30 years, but suddenly there is another liver he has taken up inside. So this liver substance, whatever is there, that is completely foreign to my entire immune system, completely foreign to my entire body. So my immune system will think maybe this is a pathogen and it will start attacking that and damage the liver, and that is what is called as organ rejection. So for that reason, immediately after liver transplantation, you give your patients corticosteroids. Why? I told you corticosteroids suppress your immune system. So corticosteroids will suppress the immune system, and when the immune system is suppressed, so there is no immune cells to attack the liver. And slowly what will happen is the immune cells get habituated to the new foreign liver which you have taken. Okay? Fine. So what is it to do with candida infection? What is it to do with the candida infection is that whenever I am taking, for example, I have got severe bronchial asthma and all the time I keep on taking that inhaled corticosteroid puff, right? So whenever I am taking that, time to time, as the corticosteroids are entering inside on every puff, the immunity of my body is decreasing. Especially where? Especially in the oral cavity. In the oral cavity, in the larynx, in the pharynx, my immunity is decreasing, because when I take a corticosteroid puff, the corticosteroids enter into this upper respiratory tract, and within this upper respiratory tract, my immune system is reducing. Okay? Even in my esophagus, even in my mouth, as these corticosteroids are entering, the immune cells there get depressed. The immunity there is decreasing. So when the immunity there is decreasing, that is a chance for this Candida albicans to attack that part where the immunity is low. So Candida albicans will enter there and cause infections. So you are taking corticosteroids from orally, right? Inhaling a puff, right? So the immune cells there will be decreased. Then Candida albicans affects your tongue, your mouth, leading to oral thrush. Okay? So now you understood why in case of inhaled corticosteroids patient is gonna have oral thrush, right? Not only this, guys, not only this, another important thing is that, for example, if I have HIV, if I am a patient of HIV, right, in HIV, if the CD4 plus, the CD4 pluses, if they are less than 500, if they are less than 500, then I have higher chances to develop oral thrush. Not only inhaled corticosteroids, but also CD4 count, if it is less than 500, then I have a tendency to develop oral thrush. So guys, in both these cases, one is asthma, another one is HIV. In both these cases, I have got oral thrush. I am going to have oral thrush. How does an oral thrush look? What is the picture of an oral thrush? I will tell you at the end. Okay. So just for now, just remember the names, oral thrush. The second important thing, after oral thrush, the second important thing which you need to know is that this skin infections, I told you, in immunocompetent individuals are gonna have mucous membrane as well as skin infections. So the next one which I mentioned here, this will be the skin infection. And what is the specific skin infection you gonna get, guys? The skin infection is Candida intertrigo. Candida intertrigo, in the sense between the closed surfaces, between the two fingers, between the web spaces, and in the axilla, right, beneath the breast. In the females, when you lift up the breast, beneath the breast, in the groin region. So these are the closed or the covered surfaces, right? So this infection has a higher tendency to attack those moist covered surfaces. That is why this is called as Candida intertrigo. Third important infection which this gonna cause is, obviously this yeast, it loves to divide in a moist areas. So diaper is a moist area. So patient gonna have diaper rash. The kids gonna have diaper rash. Fourth important thing is that it is gonna cause a specific type of infection which all of you know, where it will mainly affect the vagina, and from the vagina you see a very thick white color curdy discharge, very foul smelling discharge, and that is called as vulvovaginitis. Fifth important thing which it is gonna cause is that this Candida albicans can even affect your angles of your mouth. So exactly here near the angle of the mouth you're gonna have this infection, and this infection is gonna spread all the way like this. So this is called as angular cheilitis. Angular means near the angles. Keel means that is the lips. So it is angular cheilitis. You're gonna end up having angular cheilitis, right? So these are the 5 infections which you see in a patient who is immunocompetent. So what are those guys? One is the asthma. In case of asthma and in case of HIV, you're gonna find oral thrush. The second thing is Candida intertrigo, diaper rash, vulvovaginitis, and angular cheilitis. Let me show you some of these pictures and then I'll go on to the next list, that is immunocompromised individuals. So now I'm going to show you the pictures. I have already told you that you get an infection near the angles of the mouth. What was that, guys? Angular cheilitis. So you see a redness near the angle of the mouth in this patient here, right? So this is called as angular cheilitis. Angular cheilitis. The second important thing is that I have also shown you a picture that beneath the breast, in the axilla, right, in the groin region, in the axilla and between the fingers, the web spaces, you're gonna have that infection of Candida, and you call it as Candida intertrigo. So this is a picture of Candida intertrigo where the woman is lifting up her breast and you can see the infection, right, the redness, the erythema over the covered surfaces. So this is a picture of Candida intertrigo. The next picture which I am going to show you is the pelvic examination which you do. So this is the vagina basically. So in this vagina you can see a thick curdy discharge here coming out of the vagina. So this thick curdy white discharge which is coming out of the vagina and it is foul smelling, this is called as vulvovaginitis. And I have already told you that in case of HIV patients whose CD4 count is less than 500, at the same time in case of patients with inhaled corticosteroids, so in those cases they are going to be oral thrush. So this is a picture of oral thrush which you can see. So this is a picture of oral thrush. Okay, this is a picture of oral thrush. The second important thing which I have told you is, in those patients who are immunocompromised individuals, what are the different diseases or the conditions which you're gonna see? So in case of immunocompromised individuals, right? So in case of immunocompromised individuals, what are the different kinds of diseases I am gonna see? The first important thing is that in immunocompromised individuals, if their CD4 count is less than 100, then patient gonna end up having a condition that is esophagitis, right? The second important thing is that these patients can also experience another important disease, that is damage to the heart, that is endocarditis. third important thing is that patient is also going to have candida infection in the bloodstream. So once if it is in the bloodstream, it is disseminated everywhere, and that is called as disseminated candidiasis. That is called disseminated candidiasis. Disseminated candidiasis. Next, the fourth important thing is that patient is also going to have another important disease, that is chronic mucocutaneous candidiasis. That is chronic mucocutaneous candidiasis. So, regarding immunocompetent individuals, these are the 5. Regarding immunocompromised individuals, these are the 4 important things which you definitely have to know. Right? So, overall, let me tell you another important point, that simple way how to differentiate, right? Obviously, by looking at the clinical symptoms, by looking at the physical examination, you can tell that this individual is an immunocompetent and this individual is an immunocompromised individual, right? But when you look at the blood values, the serology part, so how you gonna know? Is that I told you that infections that are caused by this candida are mainly affecting 2 groups of people. One group of people is called as the immunocompetent people, and the other group of people is immunocompromised individuals, right? So simple way to differentiate between this immunocompetent and immunocompromised is that in immunocompetent people you gonna see T cell deficiency. You gonna see what? You gonna see T cell deficiency in immunocompetent people. But whereas in immunocompromised individuals, what you gonna see? In immunocompromised individuals, you gonna see neutropenia. You gonna appreciate neutropenia in immunocompromised individuals. So what are the risk factors? Regarding the risk factors, which group of people are most commonly affected with this? I think all of you know these risk factors by now. The first group of risk factors is, I am telling you, those who are using corticosteroids, right? Recent corticosteroid use, recent CST use. CST means corticosteroid. Recent corticosteroid use. Second is those group of people who have got neutropenia. And finally, those group of people who had recent antibiotic use. So, recent corticosteroid use, neutropenia and recent antibiotic use are the most common risk factors which you are going to see. Right? Now, when it comes to oral thrush, I already told you that in those patients who are immunocompetent and using the inhaled corticosteroids, you're going to see oral thrush in them. Right? So, when you see oral thrush, how can you describe this oral thrush? So, there are some white color plaques on the tongue, right? And these white color plaques, when you try to scrape them off, they are easily scraped off. So, you can scrape off, right? So, you're gonna see white plaques. On the tongue, and these white plaques on the tongue, they can be scraped off. You can scrape off them. Second important thing is that Candida intertrigo. This is your Candida intertrigo. You see in Candida intertrigo, look at the patches. How are the patches? They are very well demarcated. You see? Okay, let me use another. So, you see, they are very well demarcated rashes, right? So, these are well demarcated. right? They are well demarcated. They will ask you in the exam when they give you a case and tell that a rash under the breast or in the axil or in the groin, it is well demarcated, right? So, this is well demarcated rash. Next, when you look at the vulvovaginitis part, I told you thick curd like discharge, right? But what in the books? In the books, what they are telling you is that that is like a cotton, cottage cheese white discharge. Cottage cheese white discharge. Cottage cheese white discharge, right? So, next important thing is that I have already told you that patient is also going to have a condition called endocarditis, right? Where did I write that thing? Yeah, this is the place where I have written that patient is going to have endocarditis, right? So, in endocarditis, what are the important things which you can see? Patient with endocarditis, itis means inflammation. So, whenever there is inflammation, there is fever. So, patient is going to experience fever, right? Not only fever, the second important thing patient going to experience in endocarditis is that heart failure. Patient is going to have heart failure, and finally, you going to listen to a new murmur. A new murmur. Simply remember this thing that fever plus a new murmur is endocarditis until proven otherwise, right? So, this is a basic statement which you need to know. Fever plus fever plus a new murmur is endocarditis until proven otherwise, right? So, till you come and prove me that no, fever and a new murmur is also seen in different cases, till then whatever statement I have told you, that will be the right. I mean, this is not the statement which I give, but basically this is a statement which every doctor knows, okay, right. Second important thing, that when it comes to esophagitis, obviously there is nothing so important to tell about this esophagitis in fact, but simple thing you need to know is that you will see white color plaques on the esophagus, that's it, nothing more than that, okay, white color plaques on the esophagus. When it comes to the diagnosis part, so how do you diagnose this case? You diagnose this case based on a specific test called as wet mount analysis. How you gonna diagnose them? You gonna diagnose by wet mount test. So in the wet mount test, you take what? What do you take? You take vaginal fluid. You take vaginal fluid, and within this vaginal fluid, you gonna find yeast, and you also gonna find pseudohyphae. So this is the end of the lecture. Thank you.